Hello, I'm Dr. Fred Portad of the Texas Liver Institute. I'd like to welcome you to the Texas Liver Institute lecture series. This lecture is entitled Fatty Liver Disease and NASH. NAFLD, or NASH, is defined as non-alcoholic fatty liver disease. NASH is non-alcoholic steatohepatitis. NAFLD includes a spectrum of pathology with fatty liver which can range anywhere from mild fat all the way to cirrhosis. NASH is part of the spectrum of NAFLD and is non-alcoholic steatohepatitis, meaning that under a microscope it looks very similar to alcoholic steatohepatitis, but occurs in people who don't drink alcohol. This can range from mild to very severe with cirrhosis of the liver. On this graphic, you can see the progression of NAFLD from just having fatty liver to having NASH with fibrosis, and ultimately to having cirrhosis of the liver, where all of the fat may be gone. This is the most common cause of chronic liver disease in the United States. In fact, 20 to 40% of Western populations may have some degree of hepatic steatosis or fat. This may be as many as 30 million Americans. And in fact, there may be hundreds of thousands of people who develop cirrhosis of the liver because of fat. The main risk factors for fatty liver are obesity, diabetes mellitus, elevated lipids or hyperlipidemia, the metabolic syndrome, which I'll define in just a moment, and in some cases, medications which can lead to the development of fatty liver, other metabolic disorders, severe weight loss over a short period of time, and prolonged use of TPN in people who cannot use their gut for eating. What is metabolic syndrome? This is having at least three of the following: an abdominal circumference that's greater than 40 inches in men or 35 inches in women, elevated triglycerides, low levels of high-density lipoprotein, which is the good cholesterol, high blood pressure, or elevated blood sugar. People who have at least three of these are defined as having the metabolic syndrome. This is one of the most important risk factors for fatty liver. The abdominal fat is different than fat in other parts of our body. In fact, this fat is metabolically active and produces hormones which can lead to the development of not only fatty liver, but also diabetes or insulin resistance. As I said, the spectrum of NAFLD encompasses fatty liver, steatohepatitis, and cirrhosis of the liver. This is best appreciated under the microscope. Only in this way can we determine if someone just has fat or has steatohepatitis or has actually started to develop scar tissue. On the left of this graphic, you'll see a beautiful normal liver under the microscope. In the middle, those white areas are fat cells that have infiltrated the liver. And in the right graphic, you see these white cells, which are the fat cells, and then areas of blue staining. These blue areas are collagen or fibrosis. When enough fibrosis exists, we call this cirrhosis of the liver. Imaging can also detect a fatty liver, and in fact, the best way to do this is a simple ultrasound. This reveals a hyperechogenic liver in contrast to other organs such as the spleen or the kidney, and this suggests to the radiologist that the person has fat in the liver. CAT scan and MRI can also be used, but are much more expensive modalities. The main treatment is weight loss in those who are overweight, but other risk factors need to be addressed, such as insulin resistance, diabetes, controlling high blood pressure, elevated lipids, and ultimately we want to protect the liver from other injury. Diet is essential, and patients who have steatohepatitis should have diets that are higher in saturated fats and cholesterol and lower in polyunsaturated fat. Fiber is certainly okay, and oftentimes vitamin E is prescribed. This is shown in some studies to be a good antioxidant and protect those with fatty liver. And 8% weight loss may be all it takes to actually improve not only the person's overall health, but to decrease the fat in the liver. This is best accomplished with both diet and exercise. The effect of exercise for 60 minutes a day, 3 or 4 times a week, is hard to argue against. In fact, 20 minutes of biking, running, 20 minutes of swimming, 20 minutes of a warm-up and cool-down period will lead to improvement in handling of sugar and decrease in insulin resistance and maybe even improvement of diabetes. This may actually lead to decrease in fat in the liver as well. For those who can't accomplish this goal through diet and exercise, another option is bariatric surgery. Bariatric surgery comes in different forms. One is the adjustable gastric banding, or commonly known as the lap band procedure. This is a restrictive procedure that involves putting a gastric ring in with an inflatable pouch that allows this to be adjusted for each patient's specific needs. This is a relatively non-invasive procedure and is commonly performed. A more aggressive type of bariatric surgery is called the Roux-en-Y gastric bypass. Here the anatomy is changed by the surgeon so that a large portion of the small bowel is bypassed and therefore less food is absorbed. This is more invasive and requires a very good team of surgeons to perform, but can certainly be one of the treatment modalities for certain patients. There are also new therapies in research. There are multiple new compounds in development at the Texas Liver Institute and other major research centers designed to treat fatty liver and scarring of the liver. Find out more by contacting centers that do research in this area. To find out more about fatty liver disease and other diseases of the liver, please visit us at www.txliver.com. Thank you for joining us today.